We're going to look at tracing the Pericardium and San Jiao pairing of the fire element, remembering that the fire element is the only element that has two Zang and two Fu channels, so two yin and two yang pairings, okay? Pericardium and San Jiao are very, very important, very effective channels to work with some really powerful points along that pathway. Starting with the pericardium, the yin channel, remembering our yin channels of the upper body start from the chest and move their way out to the extremities. The pathways are bilateral, so whatever and however the line is traced on the right is exactly the same on the left. We start just adjacent to the nipple, comes up and over, following down the midline through the middle of the crease, okay, where you can feel that little indentation. Keep sliding your finger up between your two tendons, directly in the middle of the palm. That's actually a way that you locate one of the points, is folding the middle finger back, and then we go all the way to the tip of the middle finger, all right? When we talk about the yin channels, remember they also are on the interior of the body, right? So that's running down on both sides. In yin yoga, whenever you're doing child's pose variation, melting heart pose, even your sphinx, we can draw the awareness into that specific pathway. San Jiao pairing, okay? So we are coming to look at the fourth finger, all right? So we count differently. We count from the extremities towards the head, remembering all of our yang channels come to meet, okay? Our energy goes upwards, all right, if that helps you to remember. And because it is a yang channel, we're talking about the outer area of the body, okay, that sun facing. Remember, if you've done workshops with me, I would have described that in a little bit more depth. So we start just along the edge, the nail bed. We trace the pathway between the fourth and fifth finger. There is a little bit of a kink, but we don't need to necessarily worry about that for palpating. We come up and over, all right, into that little groove. We work our way up along the shoulder. It traverses around the ear and comes to end just on the lateral edge of the elbow, all right? So an interesting point if you think of using props or any time that you're turning the head, also in terms of tapping application, all right? And then threading the needle, all of these would be good options to stimulate into that pathway.